In answer to your first question, the answer is yes, we are considering that. And that is one of the reasons why we've asked local governments to identify facilities that could be of use in dealing with either self-isolation or to be able to house individuals. So yes, that is something that is underway. In regards to the second question, yeah, that's a very serious issue that we're trying to deal with. And so what the powers and what the orders we've announced today will allow us to do is to determine what additional supplies are available here in British Columbia, where they are, how we can coordinate to make sure that they get to where they need to be. There's a lot of that work is going underway already. As you know, Minister Dix and Dr. Bonnie Henry are working on that plan to ensure that we have the protective equipment and the health equipment that is necessary. And I know that they will be doing further updates later today and later this week. I can also tell you that we've had very good response already from industry in terms of identifying what equipment may well be out there. We're also working very closely with the federal government on this issue. The other issue that is being dealt with in terms of these orders is it's allowing us to identify critical gaps in different parts of the province so that they can be addressed, but also to be able to put in place the necessary transportation measures, whether it be by air, by marine, truck or rail, to ensure that supplies get to jurisdictions right around this province when and where they're needed.
Add a couple of points, Vaughn. Firstly, as you know and have commented on, unprecedented capacity within our acute care system has been created over the past couple of weeks to prepare for any eventuality. But, out of an abundance of caution and appropriate emergency planning, alternative sources to put people to get the care that they need that may not be acute care is an appropriate part of the plan. And Dr. Henry and her team have been working on this for some time, and this is just a natural evolution of those implementing those policy decisions. With respect to equipment, we've been working the Council of Federation, premiers across the country, to ensure that we're doing our level best to not duplicate creating manufacturing capacity for potential shortages as a result of supply chain issues on the health side. And a good example of that would be Ontario, which has got a massive manufacturing space as a result of the downsizing of the auto sector. And of course, talented Canadians are being asked to step up with innovative ways to find solutions to potential disruptions in our supply chains. And I'm really, really excited about that. Again, another example I think that all Canadians should be proud of people putting aside regional concerns, partisan concerns, and focusing on how can we all work together. And we don't want to reinvent wheels. If Ontario is the best place to put in place manufacturing capacity to meet our needs, that's what we should do together. And the federal government has been coordinating that very effectively. And again, to all of the watchers or viewers today, take comfort in the fact that people are focusing on people, as they should. That's not always the case in daily life here in the political sphere, but today, in the current circumstances, emergency circumstances, unprecedented circumstances, people are all pulling together. Those very few outliers that people have talked about and seen, the hoarders, the profiteers, and those that are selfishly putting themselves ahead of their neighbors and their community, those are the people we're speaking directly to today. Get on board with the rest of the province and the country, and we'll get through this.
The unit that you're talking about is a group that comprises key ministries and members of industry in determining what some of the roadblocks are that need to be overcome, and also in terms of identifying the best way to get some of the supply chains moving. We've been very pleased with the discussions that we have had already on these issues, and a lot of them are being resolved. And you're seeing it right from at the very base level in terms of how many stores are already putting in place the social distancing measures that are required, to identifying problems. One of the ones which the measures that we deal with is that ability to deliver goods any time of the day or night to get them into communities, to get them into the stores. But it also looks at if, for example, there are challenges in certain parts of the province in terms of getting goods to that location, what's the best way to do it? Many airlines now, or large and small, have spare capacity now. We want to bring them in so that they're able to assist us. So it's very much a cooperative effort. It does give us some considerable power, but again, it's all about planning for the long term as well as the immediate needs. As Dr. Bonnie Henry has said on many occasions, this is a marathon. It's not a sprint. And so we're doing everything we can to make sure that we can deal with the immediate, but also have in place those measures that we're going to need for the medium and the long term.
And I would just add, Dirk, the reason I chuckled is that I saw a tweet the other day of a friend of mine who had bumped into Jimmy Pattison at one of his outlets in Vancouver, there talking to staff, talking to customers. So Jimmy Pattison and the entire business community, to be quite frank, has been overwhelmingly supportive of offering suggestions, offering proposals, taking advice from government about how we can get through this. And that is absolutely critical. We always think, of course, of our healthcare workers, our doctors, our nurses, our care aides, who are our paramedics, ambulance attendants that are right there every day, but we also need to make sure that those shelves are stocked and people get the food that they need. We need to make sure that childcare is available for first responders, frontline workers, not just those critically important health workers, but also truck drivers, warehousemen, people who are keeping the supply lines going. And I marvel at 90 years old. Jimmy Pattison is out in his stores talking to employees, talking to customers, and I think that's symbolic of what we would like to see from all British Columbians, those better angels stepping forward to do what's right, and I know we'll get that in full measure from our business community.